Hi again, this is Dr. Jacobson with another presentation on golden advice for passing the Adex exam. For this lecture, I'll be covering the Osce. This slide provides you with my background. I'm the author of Clinical Dentistry Daily Reference Guide. This book is a one-stop resource loaded with critical information for day-to-day clinical decision-making. I wrote this book to help dental students and dentists better navigate the complexities of dentistry. I took the Osce exam in 2022 before taking the simulated patient exam. I have other videos where I cover how to prepare for the simulated patient exam. I passed. I learned a lot along the way, from practicing for this exam to surviving this exam, and I will share everything I learned with you to help you succeed, including how to pass the perio, restorative, prostho, endo, and Osce. Disclaimer: of course this video does not guarantee a passing score. So let's get started. I'm going to cover what is the Osce, where do I take it, when do I take it, what is the format, how is it graded, what is on the Osce, and how do I study for this exam? So what is the Osce? The CDCA Reb administers the Adex Clinical Dental Licensure Exam. Adex stands for American Board of Dental Examinations. So when you take the Adex exam, there are two major components. The first component is the written computer exam. That's the Osce. The second component is the simulated clinical examination, which is on mannequins. That's where you're doing the root canals and crown and bridge preps. I have other videos for that, but today we'll cover the Osce, also known as the DSE Osce, Diagnostic Skills Examination, Objective Structure Clinical Examination. Now I see why it's abbreviated. To apply for the written computer exam and the simulated patient exam, this is all done on the CDCA exams website. Where do I take the Osce? After you register and pay on the CDCA website, you'll receive an email with more details. You'll take this exam at a Prometric test center. You may be wondering, when do I take the Osce? You can either take the Osce before or after the mannequin exam, as long as you follow the 18-month rule, which means you have to complete all 5 parts of the exam within 18 months. What is on the Osce? It's broken down into 2 sections with a 15-minute break between. The exam is 4 hours long, and according to the manual, progressively assesses more complex levels of diagnosis and treatment planning knowledge, skills, and abilities. It may include some pilot questions, which are for future exams, but don't worry, that does not affect your score. The 3 areas of study will be addressed. The format of the exam includes multiple choice questions, either single response or multiple responses, extended match, drop down, fill in the blank, hot spot, and drag and drop. When you take the exam, you can skip or mark items to be considered later. There are 165 scored points and 15 are pilot questions. The final score is based on the percent correct and scaled to equate scores from year to year. You need a 75% or higher to pass. What is on the Osce? You're being tested on the following material: patient evaluation, which is 20% of the content. This includes pathology, physical evaluation, anatomy, identification of systemic conditions, radiology, lab diagnostics, and therapeutics. Comprehensive treatment planning makes up 60% of the content, which includes systemic diseases, medical emergencies, special care and oral medicine, periodontal diagnosis and treatment planning, restorative dentistry, and specialties, which includes endodontics, orthodontics, oral surgery, and pediatric dentistry. Lastly, cross-cutting clinical judgments makes up 20% of the content, which again includes medical emergencies, and infection control and prosthodontics. I'm sure you are wondering, how do I study for the Osce? According to the manual, no single textbook or publication can be used as a reference, and that the examination is based on concepts taught and accepted by educational institutions accredited by CODA, the Commission on Dental Accreditation. Students have told me that they've used various resources to prepare for the Osce. Some used the material they studied for the INBDE. Some have mentioned a website called Quizlet, while others have said my book helped them to prepare. I took the Osce years after graduating from dental school, at a time when I was just wrapping up my manuscript for my book, Clinical Dentistry Daily Reference Guide. Writing this book really helped prepare me for the content of this exam. I've highlighted the content which overlaps with content in my book, Clinical Dentistry Daily Reference Guide. I wish you success on the exam, and check out my website for more student resources at williamjacobson.net.